I'm Dr. Peter Apel, a hand surgeon at Virginia Tech Carilion in Roanoke, Virginia. Thank you for your interest in our study. Modeled, wide-awake, local anesthetic surgical procedures do not impair driving fitness, an on-road non-inferiority study. I became interested in this line of research when I started incorporating these Wallant techniques into my practice. As we eliminated anesthetic and sedation, patients began to have the ability to drive themselves to and from the surgery center, and many asked me, is it safe to drive? There was really no literature available to answer this question. So I reached out to our colleagues at the Virginia Tech Transportation Institute, Dr. Miguel Perez and colleagues, who are experienced transportation researchers, and together as a collaboration we designed a study where we recruited normal volunteers. They were injected with lidocaine, with epinephrine, just as we would numb someone up for a carpal tunnel release, and given a bulky soft bandage. They drove on a controlled course as well as naturalistically on city streets with a driving researcher present. We measured many aspects of driving in order to assess driving fitness. We were surprised to find that drivers actually drove more conservatively after the injection and having the bandage on, presumably due to a belief or a perception that they did have some amount of impairment. The objective data, though, did not support this. The objective data told us that they were not impaired, that they had no difficulty with parking maneuvers, with braking, with cornering, and they were even able to navigate an obstacle where a box fell off the truck in front of them. Of course, that was a controlled part of our experiment. Overall, we feel like the results of this study support patients being able to drive themselves home from surgery, and that hand surgeons should not discourage their patients from doing so if they otherwise feel comfortable. For us, some other questions still remain unanswered. What is the impact of more complex tendon surgeries, for example, or distal radius fractures that may have more pain? In the future, we're continuing to examine not only patient driving behavior after surgery, but also whether or not there's things that we can recommend specifically, or perhaps interventions we can make so that patients are safer when they drive, thus making the surgical experience less burdensome and more accessible. Thank you. We hope you enjoy the article.